Dr. Ennis, lately in the news, there was a fair amount of data about that people who wear dentures, they also use adhesives. They use denture creams. One of them called Dentafix, I think, or Fixadent, anyway, something like that. But anyway, most of those dental creams, they contain a lot of zinc. And while the body does need zinc, if it's constantly in your gums and in your, around your bones, in the mouth, which is the gateway to the blood vessels. You can get a person alive by putting a few drops under his tongue, and it goes in the blood right away, and he goes, oh. So, when there's too much of that, apparently some people now have nerve damage. It's not totally proven, but things like that take usually decades to prove. But the point is that apparently people have major nerve damage, which handicaps them physically and mentally. Have you heard about that news, and what is your take about the possibility of that?
Actually, I've had one case that presented to me asking that question as to whether or not he had zinc poisoning. We evaluated him and did not find any clinical evidence of zinc poisoning, and we did a bunch of blood work and did not find any evidence of any zinc poisoning with the blood work. I actually referred him to a dentist because it was more a dental question than one for me. And after the dentist evaluated him, he also did not find any evidence of any zinc problems.
Right.
So I certainly have had one case that has asked me that question.
Right. So that was a question, and that's good. Obviously, not everybody gets it. It's not even 100% proven, but that case is out there. And so you did evaluate, nevertheless, the person. So if a person thinks that he has, again, numbness, because it all boils down to the same thing. When the nerves not function, you get numbness in your toes, in your fingers, you get muscle weakness, you get tingling and stuff. Would you say it is wise for a person to visit a guy like you who can do a nerve test, who can check that stuff out, and again say, oops, be careful, or like, no, you're fine, and which is the result the patient should be hoping for. But would that be a good first step for you, for a patient to do?
Yeah. Yes, certainly. We would be delighted to be able to see a case that had those. Certainly it's something that we do every day in terms of doing chemical analysis of things. Patients that have dental problems certainly need to be managed by a dentist, but we oftentimes work in concert with a dentist to reach a resolution. We can evaluate the neurotoxicity related to heavy metals. And certainly the dentist can manage the dental problem.
Which the way, as you well know, and as you mentioned before to me, one of the reasons you are referring the people, to a dentist. Number one, if the patient is worried about that this cream is affecting him, he can get these days dentures with a couple of implants. And by doing so completely eliminates the cream, and on top of it has a much, much better fit of the dentures. He can actually now bite an apple and chew on spare ribs, which with normal dentures is a little questionable. And he has better taste in his gums because up in his palate, simply because there's not that plastic over. And most importantly, there's a snug fit, meaning the dentures fit. And for that patients who came to you with worrying about it, since it's not proven completely one way or the other way, but there's a potential of it, no more denture cream ever needed, and I guess that's obviously that's then the dentist's job, but that would be the two steps. Get evaluated whether something is wrong. If something is wrong, let's fix it. Either way, get off the denture cream and do something that you don't need it anymore, which is why you then refer him to a dentist, right?
Absolutely. Yeah, I could not have said it better myself. That's exactly what occurred. We didn't find evidence of any problem, and we referred him to a dentist that managed his dental problem so that he no longer needed the cream. That's exactly what we did.
Wonderful. Well, all right. Thank you very much again for your rather informative information here. Bye-bye.